By the end of this podcast, my goal is that you feel comfortable skipping surgery if it's truly not needed, skipping injections, and going straight to a physical therapist who's going to listen to exactly what all causes your low back pain, what you have tried that has worked, what you have tried that did not work, and give you a good assessment and pinpoint the problem of your low back pain, therefore leading to a plan that is going to help you solve your low back pain once and for all. Now, I say once and for all. It might not be overnight. It might take time, and you might still have flare-ups, but I want you to feel comfortable having direction on why your low back hurts. If you have typed into the search bar low back pain relief and you have tried to figure out why your low back hurts, and all you get is surgery, injections, medications, or very stupid hamstring stretches, then you are in the right place. I'm going to give you the spiel that I give almost every low back pain patient in my clinic that usually walks out with a good understanding on why their back hurts and a great plan moving forward. Most of the time, people's low back hurts because either one, when they point back to their low back, they're actually pointing to their hips, and this whole time they've had a hip issue, not a low back issue, or they truly have low back pain, and it still comes down to the hips not being very strong. And when the hips are not very strong, you have over recruitment of the lumbar extensors or the low back muscles. And when those low back muscles are overstrained, they go into spasm. And when they go into spasm, you are left with a sensation of compression in your low back. So most of the time, yes, it all comes back to the glutes. Just like in the upper body, the rotator cuff of the shoulder is the glutes of the hips. It all comes back to either the rotator cuff or the glutes, at least in my observation. Now, to give you a little bit of breakdown on how these incorporate into your low back and how they incorporate also into hip pain and potentially even leg pain or sciatica, I'm going to start there. And then I'm going to finish with talking to you about how strengthening these muscles will actually decrease your spasm. It'll help you not have this pain come back in the future. And if you want specific instructions, I will have my top 3 most recommended videos or exercises that I give to almost all my clients with low back pain in the description below. By the way, my name is Dr. Clayton Dir. I am a physical therapist, and I've helped hundreds of people in my clinic, in the clinic that I work at, and thousands of people online solve their pain once and for all. And I hope you listening are going to be one of the next ones that get benefit. When it comes to low back pain, we often see that your hip abductors and your hip external rotators are very weak. Muscles that make your leg kick out to the side or stabilize your knee when you're in an upright position. And hip external rotators, muscles that help you rotate the hip or help keep your knees stable as you go down into a squat or as you step up onto a tall box, a stair, or even hiking. When these muscles are not doing their job well because they are not strong or they do not have the capacity, they can either refer pain into the low back, they can refer pain into the hip, or they can refer pain down the leg, sometimes confused with a radiculopathy, which is a nerve impingement or nerve issue. More times than not, I see it as a muscular issue and the muscle is referring the pain. When these muscles are not very strong and you use them more than they're able to, they can either cause spasm in the hip and refer pain, or it can lead to you asking your low back muscles to do more work than they are capable of. An example I often give is if you have a restaurant that has a bartender, a server, a host, a cook, and a manager, and that bartender calls in sick one day, the other employees have to take on more work that day, and they are going to be very angry. And the question rises, do you want to make everybody else be more capable of taking on the work of that bartender? Or would you rather bring in another bartender to fill that position so everybody can stick to doing their job? I would rather the second. So instead of going to where you feel the pain and only treating the symptoms, whether it be ibuprofen, injections, medications, surgery, I would argue that you should find the muscle that has called in sick from work and strengthen that one. And oftentimes that is the hip muscles, the hip abductors and the hip external rotators and even the hip extensors. For simple, we're just going to call them the glutes. We are going to make those muscles stronger, build you capacity, and then also teach you how to use those stronger hip muscles in every movement that you do. This is usually a multi-visit process. I don't even teach all this to someone in day 1, but I want to expose you to the information so that you know there is a plan for stuff like this. There's a method to solving your pain, and it does not have to include pills, injections, or surgery. Step 1 is finding where the weakness is. And in my evaluations that take no more than maybe 15 or 20 minutes of objective testing, meaning, hey, move forward, move backwards, let me see how you move, let me test strength, range of motion. That usually doesn't take that long. I usually finish with giving someone a report card of here's where your weakness is, Here's where your mobility deficits are. Here's where you're actually really strong. And here's actually where you're really flexible. And here's how that is playing into your pain. When we finish that, I say, we're going to fix this weakness by giving you this exercise, laser focused at this muscle. Here is where you are immobile and I need more flexibility. Here's what you're going to do for that. Now, today, I want to give you some sort of relief. And the relief is usually in the form of a technique called dry needling. What dry needling is we find the areas that are spasmed. They are likely spasmed because they are either weak or you have over-demanded them. I will find that spasm, sometimes called a trigger point or a knot in the muscle. And then I will take a needle, a little tiny acupuncture needle, and we poke that muscle. We get it to twitch and then relax. To put it super simple, I'm essentially poking the muscle to make it release. I'm trying to get it to release so that you can feel a relaxation of that muscle and ultimately relief from your pain. Oftentimes I will hear patients even say, wow, that is actually exactly my pain. You are touching my pain. How did you know that was there? And that is where I know this person's going to get fantastic relief. After we dry needle the muscle, I will then give you exercises, like I said, laser focus at your weakness or your problem. It'll start retraining that muscle, sometimes making it go from weak to strong, and other times teaching it to move without going into spasm. Then we will talk about a plan of care, and that is what a normal low back pain evaluation looks like. Now to finish off, I have put a lot of stock in the fact that your back pain is probably a hip issue. I speak that from confidence because the research shows it, and anecdotally, the majority of my patients fall into those buckets. The second piece I often see, though, is people having low back pain because they're almost stuck in what's called an anterior pelvic tilt. Now, I do not buy into the idea that an anterior tilt is just something you're born with or something you have. I think it is a position that your low back and your body has found to be a position of stability, even if it is working against you. And we get into that position usually because if I ask you to move in a certain way or lift up a heavy weight, you are very naturally likely to turn on your lumbar extensors, the muscles that extend your low back or help you lean backwards. Those turn on first, and that's your position of stability, even though it hurts you. So we first have to teach you how to do a posterior pelvic tilt, sometimes referred to as tucking your tailbone. Imagine either making your butt tuck underneath you, or if you had a belt buckle on the front of your hips and you wanted to tilt that belt buckle up towards your nose, like I said, tucking tailbone usually describes that rather well. That usually provides a stretch type sensation in your low back, and it actually teaches those lumbar muscles to relax and calm down and not go automatically into spasm. We then teach you how to do that over and over again, so it's easy, and then teach you a new position of stability in your core. I don't believe you have core weakness, at least the majority of the time people do not. They have more a core coordination issue. They need to learn how to find a position of stability that is not going to work against them. And it's usually these two things that wrap up into why your low back is having pain and why you keep having pain, because you keep not solving the problem. That is my spiel on low back pain. If you have any questions, please reach out to me. My email will be down below. If you want my 3 most common exercises that I recommend for people, they are called 90-degree clams, 7-way hips, and lifter's bridge. This is usually the foundation that I start most people on. Those are listed down below. If you want a full protocol, I also have one. You can just reach out to me via email or go check it out on my website. If you have any further questions or need assistance or even have suggestions on who I should have on the podcast next, please reach out to me and I will be happy to help. And I hope you learned a little bit more to heal without harm.